So today I wanted to talk to you about a condition we see a lot of with kids, particularly at this time of the year, with them starting all their winter football coats, and that's one of heel pain. Now there's a number of different names for this particular kind of heel pain. Calcaneopolisitis is the anatomically correct one. It's also called Sever's disease, which is a terrible name because it's not a disease state. It is just a inflammatory reaction to a set of biomechanical issues going on with the children. So if you've got someone who's around about 10, maybe 12 years of age, who's very active and starts developing heel pain, there's a good chance it's Calcaneopolisitis. So the typical pattern of this is they don't feel anything initially when they're playing their games, but when they come off, the heel just starts to get sore. And unchecked, it gets worse and worse till it starts intruding into the game itself, and they can't see a whole game out, and it may even get to the point where they can't play at all. Now, Calcaneopolisitis is essentially an inflammation of the growth plate in the heel. So what you have here is an x-ray of a pediatric foot. So what happens as we're growing, all of our bones grow from areas called growth plates. And that's where the ossification process, where the spongy cartilaginous bone starts turning into hard osseous bone. And in the heel, you can see that there's a big growth plate across here. It looks like a big fracture on an x-ray, but it's just a normal growth plate. So the growth occurs within that growth plate, and gradually the bone gets bigger from there. Then they reach a certain age where it starts to ossify. So the two sides of the bone start linking up, creating ossification bridges, and eventually becoming one single bone, and that's when the growth stops. Now, in a child who's 10 to 12 years of age, they typically have a large range of movement in their feet. So they're running around, the feet are rolling in a lot, rolling out a lot, which is totally normal. But what you can have is a band of ligamentous type material called a plantar fascia, which runs along the bottom of the foot and anchors back here. Now at the same time you have an Achilles tendon which comes down the back of the leg and anchors up the top here. And they are actually linked, there are fibres linking the two. So when you've got a foot that's rolling in a lot and it's stretching this fascia and pulling on here, plus a tight Achilles, which most kids have because they're growing and the bones grow faster than the muscles and the tendons, it's like you've got these two traction forces trying to displace or pull apart that growth plate. And it becomes very inflamed, very hard to walk on, and quite debilitating. Typically it will resolve, but it could take over a year for that to happen. And in that time, your child may not be able to play sport at all. That's if it's untreated. If you intervene, it can be cleared up relatively quickly. I'm talking 4 to 6 weeks on average. So what we need to do is address the biomechanical issues that cause that. So with the Achilles, one of the things I always do with kids and their parents is show them how to do safe, controlled stretching that will introduce greater flexibility into the Achilles and stop that traction force. If they've also got a large amount of movement through the foot, sometimes they need an orthotic device to help reduce that, and also good footwear that's going to give their feet plenty of support. There's a number of other things we do here as well. Check that the ankle isn't locked up, and we do a little bit of fascial massage as well. But it's the kind of condition that if you get on top of, you can clear up relatively quickly. If you don't, you're going to have a whinging kid for quite a while. Thanks.